of the head with the body. These impulses are continuously with a very high speed transmitted to the junction of pons and medulla. There are 4 nuclei on each side, superior, inferior, medial, and lateral, 4 on the contralateral side to control the balance of the whole body. Semicircular canals, as we know, controls dynamic balance, active balance, circus-like movements, monkey-like movements, gymnastic-like movements. Everything that you see perfection in the movement in Olympics, on Winter Olympics, is because of semicircular canals. In resting condition, in lying down, in sitting, in sleeping, the balance is controlled by the utica. Is a static balance, is a dynamic balance, that is continuous impulses from the both these fine organs are being sent to the junction of pons and medulla. From here, the nuclei are connected with the cerebellar nuclei. The dynamic balance is controlled by flocculonodular lobe, anteromost part of the cerebellum that abuts the medulla oblongata. Certainly, these dynamic balance and static balance is finely controlled at automated level, autonomous level at the junction of brain stem and cerebellum. And the cerebral cortex is apprised, is certainly giving signals how fine you are at this moment or while doing something in the oval. Dizziness or vertigo is simply subjective sense of imbalance. That is a standardized statement. Peripheral vertigo, that is by the, not in the CNS, that's controlled mainly by the vestibular system, the inner ear, the central mean, brainstem, cerebellum, or cerebellar cortex, mainly at the brainstem. It could be commonly asked, peripheral vertigo and central vertigo. What's the main difference? Peripheral vertigo or imbalance is usually peripheral vertigo or imbalance or giddiness or dizziness is very, very severe. It's having stimulus, it's having a latent period, then appearance of vertigo. It could be infection, it could be trauma, it could be something vitamin D deficiency, bone deficiency states, and many pathologies we'll discuss later on. If it is very severe, it's always associated with nausea, retching, vomiting, and it's always fatigable. It may be associated with deafness and tinnitus. Then it is certainly inner ear in origin, if these two symptoms are there. Central vertigo is mostly long-standing, mild to moderate. It's having no stimulus, no latent period, not fatigable, usually associated with other CNS symptoms like hemiplegia, like weakness of ipsilateral side, cerebellar symptoms, dysarthria, dysdiadochokinesia, and various cerebellar symptoms. Common causes are mostly vestibular or cervical, and among vestibular, 80% are benign paroxysmal positional vertigo. Second common is vestibular neuronitis or vestibular neuritis. Thirdly, we talk about Meniere's disease. Today we'll go through Meniere's disease as we have already gone through these two symptoms, these two pathologies. Benign paroxysmal positional vertigo is most common cause of vertigo. It is calcium carbonate crystals from uticle has fallen into the semicircular canals, mostly posterior or inferior semicircular canal. Vestibular neuritis is a viral condition. It's very, very severe. and it happens just at the midnight, early in the morning, and patient is unable to move, is the most severe form of vertigo here. We'll talk about Meniere's disease in detail, cervical spine issues like bamboo spine, cervical spondylitis, and various, because posterior part from the spine, the vertebral arteries pass through foramen transverse cerium. As the spine is immobile, having little movement, there is atherosclerosis, then certainly supply to the circle of Willis from basilar artery through vertebral artery is compromised, and there's knockdown effects, this blackout effects, which is commonly seen in cervical spondylitis. Cerebellar issues, CVA, hypertension, diabetes mellitus, anemia, drugs like aminoglycosides, chloroquines, like loop diuretics. Patient could be psychogenic, having no issue, but something wrong at home. Our patient is misfit somewhere. Another very, very common cause is motion sickness. During traveling, during high altitude, during shipping, during traveling through ships, then certainly this motion sickness or seasickness is so severe that patient can die away. So one should move with empty stomach, can have few sips, and can have prochlorperazine or Stemetil that can work very well. Meniere's disease, my dear friends, it is relatively uncommon as compared to benign paroxysmal positional vertigo and vestibular neuronitis. Third common cause is Meniere's disease. It is usually triad of symptoms, and mostly the disease starts with episodes, short-lived episodes of dizziness, short-lived episodes of vertigo. For a little time, there could be tinnitus and fluctuating hearing loss. Initially, it is low-frequency hearing loss. Pathology most often seen is high drops. Endolymph fluid is with a high pressure inside the inner ear. That's the main finding. It is being said that either it's overproduction or it's a very poor absorption that leads to engorged, hyperdistended endolymphatic sac, endolymphatic ducts, or endolymph containing tubule system of the inner ear. That distended, it's exactly similar condition you will see can appear with trauma, with inflammatory disease, with some drugs. It mostly distends and leads to abnormality of the basilar membrane and breaks or ruptures of the regional membrane. It was physician from France, a French physician, Prosper Meniere, who first noticed a long series of patients having episodes of vertigo, fluctuating hearing loss, and some tinnitus. And in between the attacks, patient is very fine. It's uncommon disease. There's expansion of endolymphatic compartment. In very severe cases, there are tears or rupture of regional membrane that leads to very severe symptoms of vertigo. This is the organ of Corti. If you see 2.5 turn of cochlea, this is the endolymphatic sac, scala vestibuli and scala tympani that is having perilymph. It's a normal scala meatia that contains endolymph. Once its production is too much, it is so much distended that the basilar membrane, over that there is basis of hair cells that perceives inner hair cells and outer hair cells that perceives hearing, that are barely disturbed because of high pressure inside the endolymph. And the Reissner membrane is teared off with the high pressure. This is very thick basilar membrane. It's very thin Reissner membrane. It is only distorted with the high pressure. Physiology of the hair cell is disturbed. They are atrophied. Even their blood supply in the form of stria vascularis is disturbed. What causes such pathologies? Nothing is known exactly. There's so many patients having some familial issues. Congenital inheritance has been documented. Autoimmune diseases can lead to post-traumatic, post-concussions, post-head injuries. Patients have been seen with endolymphatic eye drops. It's relatively uncommon cause, but it's very serious disease. Male are more affected as compared to female. At the end of the day, after long-term bilateral involvement happens. It's a scala meatia containing endolymph. It's a scala vestibuli. And here is a basilar membrane that's having inner hair cells and outer hair cells. And if the pressure is normal, physiology is functioning so good. Once the pressure is raised here in the endolymph, scala meatia is highly distended. Everything over here on the basilar membrane is atrophied, is a pressure defect. And scala meatia in normal posture, when it's distended, there's rupture of Reissner's membrane, tears in the Reissner membrane. That leads to certainly episodes of vertigo and hearing loss. Episodes of vertigo and hearing loss. That's very common in Meniere's disease. Clinical symptoms are very clear. Here, the patient, it is uncommon, benign paroxysmal positional vertigo, and vestibular neuronitis is very, very common. Vertiginous attacks, giddiness, dizziness, episodes often associated with nausea and vomit. Patient's life is crippled. Patient is unable to perform their duties. All these patients needs rest for a few days to be normalized. But the symptoms remain for a few minutes to few hours, sometimes for the whole day, but most often few minutes to few hours. Tinnitus is often associated with vertigo. It is short-lived. It is hearing loss that is initially sensorineural, low frequency, and fluctuating. And after the attack, the hearing is totally restored. But after a few months to few years, hearing loss becomes permanent. And at the end of the day, after many years, the patient is having very little hearing. And if disease is bilateral, the patient's life is really crippled because of hearing and vision should be very normal, for normal routine of life. If we can't hear, we can't reply, we can't communicate, we can't enjoy our family, friends, dear ones, and loved ones. Certainly, when you are absolutely on the lonely planet. Once you are all alone, people are around you, they're unable to communicate to you, then certainly the life is in a very bad situation. Treatment. Most often the medical treatment works very well. It works so nicely that patient hardly needs much to do. So patients should be reassured that it's not a life-threatening issue, but you have to have medicine once there is an attack, and what are the parameters you have to take care of. All patients who are having epilepsy, fits, seizures, are severe attacks of vertigo. Precautions are the same. patient should be immediately, once he or she feels some dizziness, some imbalance, patient should lie down. If the patient has already fallen, certainly you should help him to be lie down comfortably, whatsoever is available at that time. It could be the ground, it could be the grass, better to have a bed somewhere, protected condition. Somebody should be with him or her. So reassurance to the patient, to the family, to the guardian, that's not life-threatening, it's a progressive disease, and some basic measures can stop the severity of this issue. Patient, if going to the washroom, fall is the biggest issue. Patient can have head injury, patient can have fracture, if there's dizziness, vertigo, or patient is having fits. So patient always needs a company, especially when he's disturbed, when he's having attack. So washrooms must be having mats. It should not be soaked. It should not be water. It should be totally dry, and he should not bolt from inside, so that if something wrong happens, he is not alone and somebody can help him or her. So all these are, he should not drive at all. One should not go close to the machinery. Somebody crossing the road can entrap with a big accident. So all these patients should stay home. Once they are totally free of symptoms, then they can restart their life, normal life routine. So please reduce salt and water intake. Spicy things, a lot of tea and coffee should be avoided. Patient needs rest. Patient should take extra care while going upstairs, downstairs. Patient should be taken care of in the washroom, because patient can slip and can have history of fall and injuries. All these precautions are mandatory to be mentioned. The single most drug in our ages, which is found to be very effective, is beta-histine. It's a histamine analog. Its effects are more or less like histamine. It's a very strong vasodilator. It acts very nicely on H3 receptors in the inner ear, internal ear, H3 receptors. It certainly leads to a very good vascularization, and it is available in 8 milligram, 16 milligram, and 24 milligram tablets. As per the age of the patient, weight of the patient, severity of the symptoms, we can start with moderate dosage. 16 milligram 3 times a day, mostly in adults, works very well. But if the patient is having very uncontrolled hypertension, diabetes mellitus, the dose has to be reduced because it hampers, disturbs the control of blood pressure. Beta-histine, in the name of Circ and various other names, is a very, very good drug. If a single drug you have to use safely, that is Circ or beta-histine, 16 milligram, 3 times a day. If patient's weight is already 40-45 kg, then certainly you can start with the 8 milligram 3 times a day for a few weeks. Vestibular sedatives. If symptoms are exaggerated, rampant, florid, extensive, then we can seriously think to add prochlorperazine, Stemtil in all these patients. If symptoms are mild, just 1 milligram tablet will certainly be sufficient at night. Otherwise, 3 times a day we can add. Cynarizine is another in the name of Strugeron. Cynarizine, 25 milligram, 75 milligram capsule and tablets are available. You can use as per the need of the patient. All these drugs, which are labyrinthine sedative, leads to some sedation of the human mind as well. So patient's sleep will be increased. History of fall may be more if you haven't taken care of. So general management is equally important in such patients. In very severe patients, if things are not settling, all sorts of diuretics, especially thiazides, has been utilized with great success, but 80 to 90% patients are fine with beta-histine and vestibular sedatives. Various drugs, if things are already in the bad state, patient's hearing has been totally lost, then chemical therapy or chemical labyrinthectomy with local injection of gentacine inside the middle ear or streptomycin or IV, if kidneys are okay, people have utilized, but mostly in the form of eardrops or through myringotomy and grommet, people are using, but in very few patients, very few patients. So coming back here, reassurance is the biggest part. It's not life-threatening. It's not space-occupying lesion. Most often, hardly there is need of CT scan or MRI. CT scan and MRI can be conducted for ruling out serious issues like acoustic neuroma. We'll talk about, next lecture will be on acoustic neuroma, vestibular neuroma, and we'll also talk about noise-induced hearing loss, another common situation in our part of the world, mostly being asked in exams. Noise-induced hearing loss and acoustic neuroma we'll talk about next time. Just to rule out such conditions, we talk about CT scan or MRI. 80% or more than 80% patients will be very fine if we have reassured, salt and water has been restricted nicely. Beta-histine over a span of many weeks works very well. If severe situation, we can add prochlorperazine, Stemtil or Strugeron. If tinnitus is the only symptom, this is a wonderful drug for tinnitus and tinnitus retreatment therapy. That works very well in late patients where tinnitus is a major symptom. So most of the patients will be happy. Final control can be achieved in more than 80% patients. My dear colleagues, just to reiterate, this 80% figure is very, very important in so many diseases. For example, otitis media with Ophion, glue ear. Almost 80% patients can be fine with the medical treatment. Same is true for the Bell's palsy. 80–85% patients will be very fine with the medical treatment. Total, complete remission of facial paralysis in Bell's palsy with or without steroids. Just with the simple measures, medical treatment, 80–85% patients will have complete recovery from facial palsy. I'm talking about Bell's palsy. And the same 80% is true for the salivary gland tumors. 80% salivary gland tumors all occur in the parotid gland. And 80% among these tumors are benign. And 80% among these benign tumors are pleomorphic. So there are so many 80% figure is very common in otitis media with Ophion, the medical treatment. Bell's palsy, again 80–85% will have complete recovery if you reassure the patient and just eradicate the underlying cause. In 80%, all tumors among salivary glands occur in the parotid. And certainly among these 80% are benign. And among these benign tumors are parotid, 80% are pleomorphic. And it's exactly opposite in minor salivary glands. Most of the tumors in the minor salivary glands and the oral cavity, especially on the hard palate, 80% are malignant. So this 80% I may say one great man from our hospital, Karachi, the professor over there, Professor Nasir Hussain, has written this in detail about 80% diseases and 80% figure. So just to repeat, I have said it for Bell's palsy, for otitis media, every treatment is successful. Medical treatment should be focused more and more because 80% are very happy with the medical treatment. There is no need of invasive or surgical procedures. So again, I said minor salivary glands, 80% are malignant. And among these 80% malignant, 80% are again very severe situation like locally and systemically malignant. Surgical treatment of Meniere's disease very uncommonly in less than 10% patients usually. Hearing preserving procedures, conservative procedures. Hearing conservative procedures, these are mostly decompression of endolymphatic sac. Through post-mastectomy, the endolymphatic sac is being decompressed. And sometimes shunt is placed so that when there's a pressure is high, there's a one-way valve that can allow, after certain pressure, just like a dam, it opens up and allow the pressure to be leaked into the mastoid cavity. It's a shunt procedure. People have tried Grommet because nothing exactly is known about its pathology. Initially, sympathectomy, cervical sympathectomy has been tried. Selective vestibular neurectomy, Gay-Sachs operation, is another procedure which is very selective where hearing is not disturbed. And partial destruction of labyrinth, especially occlusion of semicircular canals. All the three semicircular canals are just opened up in a small amount of bone pate. Bone pate or bone patty is placed inside it, and sometimes the small amount of muscle is also inserted in the small duct, endolymphatic duct. Destructive procedures are certainly labyrinthectomy. That's very easy to do, but this is only being performed very, very rarely in situation where hearing is already non-useful. There is no hearing at all. The life is very crippled because of vertigo, because of tinnitus, and hearing is already damaged. Only in that very selective patients, one can think about chemical labyrinthectomy. There is surgical labyrinthectomy, and various procedures has been adopted. So most often we are happy with the conservative treatment. So I'll just repeat this very common topic so that nothing is missed. Subjective sense of imbalance is called vertigo. Balance is a learning reflex. जो ज़्यादा learn करेगा उतना ही balanced होगा. There is a big difference between walk and catwalk. Those who have trained nicely, they can have very good fine movements of body, especially Olympic-like, and very fine movements of gymnastics can be performed with a high degree of learning. Vestibular apparatus plays a very key role with a high fast speed, many thousand impulses per minute, 5 to 6,000 when these are stimulated. Proprioceptive sensation through spinal cord, very slow as compared to vestibular system, but continuously upright tells the brain where is the position and which part is tired, which part is not contributing, so that proper arrangements can be made in time. Semicircular canals plays a key role in control of balance and continuously send impulses at the junction of pons and medulla, 4 nuclei on each side. It predicts ahead of time, 0.5 to 0.6 milliseconds ahead of time. Body is expressed nicely that you may fall, so that the proper arrangements in tone and muscular movements are made, so that the body remains fully under control. Static balance and dynamic balance, controlled by saccule, utricle, and dynamic balance. Sorry?
Sir, just 5 minutes left.
5 minutes. I'll just finish it. In semicircular canals plays a very active and dynamic role in the balance. Peripheral vertigo, central vertigo. Peripheral mostly being problems in the vestibule. Peripheral vertigo is usually having a stimulus, infection, trauma, some position. It's a short-lived, it's having a latent period, it's a fatigable. It could be associated with deafness and tinnitus. Not always. Central, usually CVA-like situation, diabetes, mellitus, hemorrhage, clot. This could be cerebellar issue. Whole brain on one side can be affected. Trauma in the brain can be a big cause. Common causes are vestibular. Most common is benign paroxysmal positional vertigo. Second one is vestibular neuronitis. And third one certainly is Meniere's disease. Cervical spine, cerebellar causes, diabetes mellitus, anemia. It's very, very common in our part of the world. Loop diuretics. Meniere's disease, triad of dizziness, tinnitus, and hearing loss. Pathology of endolymphatic hydrops, either overproduction or poor absorption, or both, can lead to endolymphatic hydrops. Distension of endolymphatic fluid is after the name of Prosper Meniere, a French physician who named it. Meniere disease is relatively uncommon as compared to benign paroxysmal positional vertigo. It's a scala media which is distended and leading to ruptures in the Reisner's membrane. Reisner membrane is ruptured, and after many episodes, stria vascularis and the hair cells that perceive hearing are mainly disturbed or atrophied. Meniere disease is relatively uncommon. Mostly medical treatment helps a lot. It is reassurance, it's a beta histine, it's a vestibular neuritis, vestibular sedative agents like prochlorperazine, Stemtil, that works very well. Hearing conservative procedures, endolymphatic sac decompression with shunt or with sympathetic with partial neurectomies or partial destruction of labyrinth can save the hearing. It is only in 10 to 20% patients where medical treatment altogether fails. And if nothing works, hearing has gone totally, patient is having severe deafness, profound deafness, patient is unable to hear, but there is severe imbalance. There's a lot of patients' disability because of tinnitus, ringing in the ears, patient can't sleep because once patient in silence, this tinnitus is highly exaggerated. All these patients rarely think about suicides. Then one can think about destruction of the labyrinth, labyrinthectomy. Surgical or chemical labyrinthectomy has been tried successfully. So have a very good time. And next time we'll go through acoustic neuroma and hearing loss because of very high tones, that is called noise-induced hearing loss. Acoustic neuroma and noise-induced hearing loss will be gone through next time. I have given you the number. If you're having any problem in understanding some improvement or to discuss some topic which has been left behind, I can go through next time. Have a very good time. Have a nice time at home. Don't go outside for small trivial things, and do something very good for your family so that you can enjoy your Eid days absolutely in a good way. Thank you very much. Thank you very much.